Alright, so we'll be going through in this video the dissection of the brain, starting with the external structures and blood vessels. I will be saying a few things as we go along that for students just starting out here the first week or two of neuroscience you haven't heard about yet, partly because I want all of you to watch this at the end of the neuroscience course, so there'll be a few things that are more clinical that we'll talk about later in the course. So let's just start here with the external structures of the brain. I've pulled away the arachnoid here. We can just see the difference here from the other side, just so we can better appreciate the sulci and gyruses that we'll point out. First thing that's often difficult is where is the central sulcus, where is the pre and the post-central gyrus, and this isn't always easy to identify. In this brain it's pretty straightforward, but to do that let's look at the frontal lobe here. So remember, the frontal lobe, we have a superior frontal gyrus, we have a middle frontal gyrus, and down here the inferior frontal gyrus. And so each of these are divided by a sulcus. So the boundary between the superior and middle frontal gyrus is this superior frontal sulcus right here. Okay? So if we follow that sulcus all the way back to its termination, notice we come to a really large, distinctive gyrus right here, and so that is the precentral gyrus. Okay, we follow this all the way down. So then this is the central sulcus. Okay, and then the post-central gyrus is right here. So just notice in most brains they kind of stand out as being quite large. So of course the precentral gyrus is sometimes called your primary motor strip, and your post-central gyrus is the sensory strip. So along the precentral gyrus then, down in this area are the motor fibers for the face, a very large representation, and then as we go up, the hand has a very large representation, in the arm. So the face and the arm for motor are located right here, okay, whereas the face and the arm sensory information is located here. Face, hand, arm, along the post-central gyrus. So again, this is going to be your central sulcus right here. Okay. Now when we do a cut here in just a little bit, the other thing that can help you determine the central sulcus is if we look here on the sagittal section. I'm just going to try to pull this away a little bit. Okay. This is called the paracentral lobule right here, and notice that I'll try to point this out with my finger. Right here is the central sulcus. Okay, and so this is the paracentral lobule. So just kind of take a peek there, even as we're looking at the lateral surface. And so this is motor and sensory for the leg. Okay, and also the bladder function, motor and sensory, is on this paracentral lobule. Okay, so that's the pre and post central gyrus and its medial portion. All right, so let's come back out here to the frontal lobe. I won't say anything about the superior frontal gyrus, but let's just point out one thing here about the middle frontal gyrus. Very important pathway originates from the middle frontal gyrus, and these are the frontal eye fields, sometimes called the saccadic gaze center. And so when we talk about horizontal eye movements and the initiation of a quick saccadic eye movement to look from your right to your left, that pathway originates here in the middle frontal gyrus. Okay, now in the inferior frontal gyrus, again, a lot we could say about that, but the posterior portion of that back in here, if we were on the left hemisphere, is Broca's area. Now I'm dissecting out here a little bit the right hemisphere because it's just a better example in this brain. Okay, but if we were on the left hemisphere, this would be Broca's area, which is the language expression area. And of course, for someone that's left-handed, there would be a decent chance that they might be language dominant here on the right hemisphere. So again, this is for getting words out. Okay. Also, just really important here, notice you've got all these blood vessels. okay, that all seem to be coming out here through this very large sulcus. Therefore, it's called a fissure. And this is the Sylvian fissure, okay, or sometimes called the lateral fissure. Okay. And so this is the floor of the frontal lobe, and as we'll see also the parietal lobe as we go back. And so all of these blood vessels come out here through the Sylvian fissure to supply the lateral surface of the brain. Okay, so these are all branches of the middle cerebral artery. So the middle cerebral artery comes out here to supply the lateral surface of the frontal lobe. It supplies the pre- and post-central gyrus, a lot of the parietal lobe back here. Okay, so just major, important here, vascular supply of this area is the middle cerebral artery. So as just an important clinical aspect of that, oftentimes it's just a little branch of the middle cerebral artery that will occlude. So someone might have a stroke, let's just say right in this area. Okay, and so just notice that if the patient is language dominant here, they're going to have an expressive aphasia. Okay, but these patients almost always are going to have a contralateral hemiplegia because the motor strip is immediately adjacent to Broca's area. Okay, again, if they're language dominant in this hemisphere. Okay, so they'd have an expressive aphasia, and the opposite side of the body would be weak. And since the middle cerebral artery also supplies, whoops, I think I pointed to the post-central gyrus. Here's the precentral gyrus. Opposite side of the body would be weak, and they would also have contralateral loss of sensation because the middle cerebral artery also supplies the post-central gyrus right here. All right. So as we go back here from the pre- and post-central gyrus, of course we have the parietal lobe, okay, back here. And okay, where does the parietal lobe end and the occipital lobe begin? That's actually easier to see if we're doing a sagittal section here, but this one is pretty obvious right here. This is the parietal occipital sulcus. Okay, so anything anterior to this is parietal lobe, and the occipital lobe just occupies this little tip right here. It's much larger here when we do a sagittal section, but on the lateral surface there just isn't that much of the occipital lobe. I think you might be able to appreciate that the gyri are much larger here for the parietal and frontal lobe. As we get back into the occipital lobe, maybe better to appreciate over here, they're just quite a bit smaller. So that's another distinctive feature of the occipital lobe. All right, so let's come back to the Sylvian fissure right here. And we pointed out all the little branches of the middle cerebral artery coming out. So if we follow the Sylvian fissure kind of to its termination, and this kind of loops around a little bit, but it always kind of angles up like this. Okay, and so follow it to its termination right here. Now notice we're posterior to the post-central gyrus, which is right here. So behind that we've got a gyrus that kind of loops around the terminal portion of the Sylvian fissure, and this is the supramarginal gyrus. Okay. And so this is parietal lobe. Okay, if we move back, it's kind of a vague area here, but the key thing is to find the supramarginal gyrus, which again is around the Sylvian fissure, right here. So behind this is the angular gyrus. Okay. And the angular gyrus is important when we talk about stroke. I will explain that if we have a stroke of the angular gyrus on the language dominant hemisphere, so usually this is the left side, patients have a very unusual condition called Gerstmann's syndrome. Okay, we want to associate that with the angular gyrus. Okay, so let's just back up here to the Sylvian fissure and just point out that the Sylvian fissure is just this really important landmark between the frontal lobe and the parietal lobe above and the temporal lobe below. Okay? So the temporal lobe consists of a superior middle, and inferior temporal gyrus. Okay, and all I will say clinically for now is that this posterior part of the superior temporal lobe is the most important part on the language dominant hemisphere, again usually the left, for understanding. So this is otherwise known as Wernicke's area. Okay, again you can see that it's the middle cerebral artery that is going to supply this area. Okay, so if we have a lesion here, then patients won't be able to understand. Okay, but if Broca's area up here is preserved, they'll be talking, getting lots of words out, no problem. They're fluent, okay, but their understanding is very poor. Okay, these patients usually have paraphasic errors, which means they say words that don't exist, makes them kind of hard to understand, or they use words in the wrong context, but lots of words are coming out. Okay, now if someone has a massive middle cerebral artery stroke that affects both Broca's and Wernicke's areas, then they have what's called a global aphasia. And so these patients can't talk, get very few words out, they also can't understand. Okay, so these patients tend to be quite devastated by this. Now, Wernicke's area does extend out a little bit into the supramarginal gyrus, and in some patients maybe even as far back as the angular gyrus. But the most important part of Wernicke's area is right here, the posterior portion of the superior temporal gyrus. Okay? Now, all of the cortex that is around the sylvian fissure here is called the opercula. So this is frontal lobe opercula, this is parietal lobe opercula, and down here is temporal lobe opercula. Okay, so if we were just to cut this away, which I'm not going to do, we would see deep inside the insular cortex. So what I'm going to do is just pull away the sylvian fissure. And if you can see in there, it's kind of like there's another brain in there. Smaller gyri and sulci. Okay, that is the insular cortex, the insula. Okay, so we'll see this better as we do some cuts through the brain, but also just to point out, just look how massive all the branches of the middle cerebral artery are located in that area. Okay, now there's one part of the insula here important to point out. Notice that it's running from lateral to medial or medial to lateral. Okay, and this is called Heschel's gyrus. And this is primary auditory cortex. Okay, which I think makes sense because the auditory part of our brain is immediately adjacent to the part of our brain that understands language. Okay, so Heschel's gyrus then is immediately adjacent to Wernicke's area. Okay, before we look at the undersurface of the brain, let's just point out here that the very large interhemispheric fissure. Okay, and so you should just put your fingers deep into the interhemispheric fissure and it will rest on something very solid, and that is the corpus callosum. Okay, these are the huge white matter pathway that connects the right and left hemisphere of the brain. So if I just pull this apart a little bit, here you can see the corpus callosum. Okay? Now notice also there are blood vessels that are lying right on top of the corpus callosum. Okay, I don't have a free hand to point to it, but those are branches of the anterior cerebral artery. So the anterior cerebral artery supplies midline structures as a big picture. The middle cerebral artery we've seen supplies lateral structures on the brain. Okay, so remember the paracentral lobule. Here, I have my fingers around it right here. Okay, that's motor and sensory cortex for the leg and bladder. So this then is supplied by the anterior cerebral artery. And that's really important as we talk about stroke and what kind of problem someone would have if they had a stroke here. Well, it would be weakness, loss of sensation in the opposite leg, and these patients usually have urinary incontinence. Let's start with the frontal lobe here. Well, I have to point out a cranial nerve here just because it's a landmark structure here, but here is the olfactory nerve. There's the olfactory bulb and tract. Okay, we're going to follow that back here to olfactory cortex in just a minute, but the gyrus that is medial to that is the gyrus rectus, which means the straight gyrus, and we can see how that is a straight gyrus. Okay, if we move out laterally here, we get out to the inferior frontal gyrus. Okay, here's the temporal lobe. Okay, so the temporal lobe, if we want to go from medial to lateral, most medial part right here is the uncus, and that is primary olfactory cortex. So notice if we follow the olfactory bulb and tract, it's headed right back then to the primary olfactory cortex. So the temporal lobe, and in particular the uncus, is the most epileptic part of the brain. So seizures will often begin here, and so if a seizure focus begins here in the uncus, patients usually have a very intense sensation of a foul odor, like burnt rubber, something like that would be classic for that. So if you get that story, you know that the seizure is beginning in the temporal lobe involving the uncus. If we move out lateral from the uncus, we come to the parahippocampal gyrus. Okay? Parahippocampal gyrus is an important part of the limbic system. So as we talk about the emotions and how the parahippocampal gyrus relates to that, that's later in the course.